Are you a medical practice owner and are struggling to grow your CCM or RPM programs this year? We have a battle-tested program that can help you explode things to the next level with your programs, get into triple digits in the next 30 days. That's right. Hi everyone, my name is Theo Harvey. I'm the owner of SensorMed. We have a battle-tested program we call our Practice Value Creator that allows you to get more value for your patient populations using our system. So let's walk through exactly what this is mean. First of all, the first thing we talk about is understanding your VCS, your Value Care Services programs. There are quite a few. CCM and RPM is just the beginning. For those that don't know, CCM, chronic care management, are for patients that have 2 or more chronic conditions that are Medicare. There's additional reimbursement for that on a monthly basis to understand exactly how they're doing at home with their chronic conditions. RPM is using medical grade devices to monitor blood pressure, diabetes, hypertension, other things to help patients at home as well, and this is payable. But there are other programs you probably weren't aware of, and even some of the old ones you can bring back. For instance, annual wellness visits have been around forever. That's something you can build once a year with your patient populations. You need to understand that and build that because that's the basis for everything else. Understanding those annual wellness visits are really key because think about it, you'll be able to now create a care plan that can be instrumental in helping the patients with these value care services. Next, you want to make sure you transition care management. This is where you're working with the hospital systems to ensure patients transition from hospital to home, from your offices to those skilled nursing facilities. This is really important to understand transition care management codes. But there are new codes now. Behavioral health integration. Mental health is such a big thing now. And now if you're a primary care provider that owns their own practice, you can take advantage of this. And there are codes that can help you with that as well. And new codes like remote therapeutic monitoring, understand if a patient is taking their inhaler if they have a pulmonary disease, or if they're doing a physical therapy. This is something that's really taken hold of for 2023. And thinking about things like principal care management. If you're a specialist, this is something you can do when it comes to managing a patient who has one chronic condition. So understanding all these virtual care services can be quite a bit. And we talked about it in a video, so check it out in the links below. We have a video specifically all those different codes and how much you can generate as you think about helping your patients more. But really understanding that is the beginning of starting this 30-day path. Next, you want to assess. And that means you want to assess your current patient populations to understand what is going on with them. You need to be aware of your patients, how many patients can qualify these programs. And one easy way to do that, if you go into your patient registry and your EMR, you'll be able to look at patients you've seen in the last 12 months. That's a big qualification for a lot of these programs, making sure they meet the qualifications from an age standpoint. They're part of the Medicare programs. And then finally, you want to filter based on their chronic conditions, like if they have one chronic condition, like basically hypertension or diabetes, or if they have multiple ones. This is going to help you filter better. That assessment is so key because it now gives you a goal, a target you want to reach. First, you understand what the programs are, and now you have a target to get to your triple digits in the next 30 days. And likewise, I have a story about that. I remember years ago when I used to play basketball, I was a point guard / shooting guard hybrid. Whenever I would get in the court, the coach would say, Harvey, before you do anything, assess the situation. So likewise, I was looking at the situation, not just my position to my teammates and where they position and where I can pass it to them, but also the defense. If the defense was moving around, are there gaps there that I can pass the ball to make a quick and easy layup? Likewise, once you assess, you'll be able to see pathways that you can accelerate and increase adoption. What do you find out if you have a large patient population that resides near a nursing home? You can take advantage of that and making sure you can assess that and move forward and a little bit faster than you normally could to get you to that 30-day path. Next, you want to look at leverage. What does leverage stand for? Leverage is thinking about what can you do with little effort to give you the maximum results. If you had a lever, you could move the world, right? And that's really key because your time is limited. If you're a practice owner, you're probably seeing anywhere between 25 to 35 patients. You're struggling just to keep up with just the day-to-day workflow. And your mid-levels are also stretched thin. But if you think about how to leverage, these programs allow you to take advantage of not just your staff to do some of the work for you, but also being able to partner with other organizations that can do this for you. They allow you to bill a lot of these programs what they call incident to. So that means you'll be able to outsource these programs to organizations that have done this at scale. For instance, my company, SensorMed, we do this all the time for our clients, and we manage thousands of patients because we understand we focus only on that. So we partner with our companies, our organizations who do this so that they can do more for you with very little effort. But also you want to leverage your team, not just your mid-levels, your nurses or your RNs or your MAs, but you also want to leverage your front house staff. They're the ones that are going to help you manage that process. Imagine the workflow. Your doctor is talking to the patient to explain the program. Patient's excited, but there's no follow-through. They're not going to do the program. That's where your front levels come in. They will come in, follow up, check it off on the list, and make sure the patient signed the consent, and making sure that you follow up with the patient at home so the right information can be delivered to them, whether it's a device or further instructions. So leveraging your staff is key, all your staff, so you can accelerate and move faster as opposed to trying to do everything yourself. The next level is understand. These programs are complicated. You need to understand how best to implement them because they have very clear rules and regulations. If you're in healthcare, you know every patient is unique and different. Every way you diagnose them is unique and different. Likewise, these virtual care services, every one of them is unique and different. For RPM, you need to understand how many days a patient can stay on the program, making sure you follow that, making sure you get consents, either verbal or written form, making sure you have a process and a workflow that can do that. Once you kind of understand that, that helps everything flow quickly because you don't want to do all this work up front and then you find out that you can't get compensated because you missed one step on that rule. And there's a step-by-step guide that we can provide to you that can walk you through each step so you understand you're following all the guidelines to monitor the patient from beginning to recruit them, to verifying they have the right insurance, to ensuring that they get the things that they need, to that monthly ongoing process. A lot of these programs require the mid-levels, nurses, or the doctor to reach out on a monthly basis because these are reimbursable programs every month. And there's opportunity to get that recurring revenue, or what we call mailbox money, that allows you to see that money every month because you're doing what you need to do because you understand those programs. But finally, the thing that we want to discuss here is how do you continue this to go forward so you can accelerate to those 3-digit patients in 30 days? And it's really evaluation, right? Evaluate constantly, how's the billing going? If you're getting ERA denials, that means somewhere in the process, you didn't verify that patient's billing information correctly. You want to evaluate how much they're billing for. You want to evaluate what time of the month you're billing. If you're billing Medicare patients in January, you're going to find out a lot of these reimbursements will not be there because you're hitting deductibles, and patients need to understand that. Some of these secondary reimbursements can be written off, or can be something that can be done working with them, or if they have something that can pay for it, supplemental insurance. These are things that you need to be aware of because this is something you can always evaluate. So as you evaluate this, you'll be able to accelerate the assessment, leverage, and understanding process, and you can move faster and faster. So if you follow this process, understand all the virtual care programs you can take advantage of, assessing your patient population so you can scale faster and seeing opportunities that didn't exist, leveraging your team or even outsourcing the team so you can understand and do more with very little work, understand exactly what's required so there's no backtracking, and then finally evaluate consistently. You will see those 3-digit patients on these programs in the next 30 days. But if you need help with any of this, look, my company SensorMed has a new program called PracticeValueCreator.io. This will allow you to understand how to implement this at scale, but more importantly, seeing how we can help you anywhere in this process that you need help so you can get where you want to go this year to generate more revenue for your practice, but ultimately better care for your patients. So go check us out at PracticeValueCreator.io.